What are the dynamics of praying with or for our patients? Will we offend them, encourage them, comfort them? And what might God do through our prayers? Here to address this topic is Dr. Mike Chupp, a general surgeon who has practiced in both the U.S. and in Kenya as a medical missionary, and who currently serves as the CEO of the Christian Medical and Dental Associations. Join Dr. Chupp in this segment of Faith Prescriptions.
I'm Dr. Mike Chupp, and I serve with the Christian Medical and Dental Associations. I'm the CEO, but I'm also a trained, board-certified general surgeon, and I was able to divide my life. 2/3 of my career in surgery was in a teaching mission hospital in Africa, and a third was in a community-based practice in general surgery right here in the United States in Michigan. During all of my years of clinical practice, I found that the cornerstone of spiritual care was learning how to pray for and with my patients in various clinical situations, and that opened the door for me to do other spiritual ministry. And I just want to share one illustration with you. My wife and I in 2012 were returning with our oldest, our son, who had graduated from high school in Kenya, brought him back to the U.S. And during that period of time, just for a few months, I plugged back into the surgery department in my practice in Southwest Michigan. And while there, I was asked to see an African-American gentleman, middle-aged, who was a diabetic that had a bad, really severe great toe infection. I saw him, there was a bad abscess, bone infection, and took him to the operating room and drained the infection, the pus. And in the post-op period, as I was at his bedside, I shared with him I was very concerned about the risk for him actually needing an amputation because of the infection. Of course, he was very worried, anxious. And I said, would you mind if I actually take some time and pray for you? I do that sometimes with patients. And his eyes got real big and, oh no, wow, Dr. Chupp, this must be serious if my surgeon wants to pray for me. I said, this is something I do commonly. I really would like to pray for you if you don't mind. I said, go ahead. So I prayed a very simple prayer. It wasn't very long. I just asked God to bless my patient and if it be his will to save this toe because the infection was severe so that he would not lose it. Over the course of several days, he continued on IV antibiotics and treatment, dressing changes, and then he went home. A few weeks later, I saw him a couple times in the office, and we were both amazed together as the infection resolved very quickly and the toe became normal again, and he was walking. Of course, he was very pleased and happy. Didn't really talk much about the prayer. And then I returned to Kenya with my family. Fast forward 2 years. And my daughter, my oldest, now she graduates from high school. We return once again, now for a year, and I fit back into the practice. I'd only been home just a few weeks in my surgery department, and a hospitalist calls me and said, Dr. Chupp, one of your old patients has requested you specifically to come and treat him for a surgical condition. And so I didn't have a whole lot to do at that point. I went straight to see the patient, walked in the room, and I recognized this man, though I couldn't remember exactly what I had done for him. And before I could say anything, he said, Dr. Chupp, now I know that God answers prayers. And he said, you may not remember me, but you prayed for me 2 years ago, just before you went back to Africa, and asked God to save my toe, and that's what God did. And so I decided, the doctor told me I had another bad foot infection, and I was so concerned that you might still be in Africa. I prayed, and I asked God to bring you back from Africa. Well, I was taken aback, and he said, and now, look, here you are. And I just shared with him, well, God may have just done that for you. I just have only been back for a couple of weeks. You can imagine that opened a pretty amazing door for ministry with that man, who wasn't a regular praying man, over the next several days as I treated his other infection. Well, before I go any further, I want to ask you two very important, they're basic questions. The first is, do you believe in the power and efficacy of prayer? I know that you believe in the medications that you prescribe and the therapies that you offer. I'm sure you're quite confident in the surgeries that you refer for or that you actually perform. Just in the same way, we have to be confident in the power of prayer and that God hears our prayer so that we're willing to invest the time, or else we really won't be motivated to pray. And the second question is this: do you already have a regular practice of daily prayer? Because if you're not already in a habit of praying, not just once a day, but throughout your day, through the various circumstances and challenges that you face, this will be a very difficult discipline to integrate into busy clinical lives and practices. Paul challenged the Ephesians in chapter 6, and pray in the Spirit on all occasions with all kinds of prayers and requests. And then he challenged the Thessalonian church, pray without ceasing. The Apostle James in chapter 5, verse 16 says that the prayer of a righteous person is very powerful and has wonderful effects. And then the Apostle John said in his first epistle to the believers, we are confident that God hears us whenever we ask for anything that pleases him. God certainly does answer prayer, but it's not always in the way that I want him to answer those prayers. So our emphasis must be that God's will is accomplished in the lives of our patients. Well, you might ask me, Mike, how can I possibly fit a practice of regular prayer into a busy clinical day? And that is an excellent question. Richard Foster tells us about unceasing prayer by stating, it is not prayer in addition to work, but prayer simultaneous with work. We precede, we enfold, and follow all of our work with prayer. Prayer and action become wedded. You know, the whole concept of praying with patients has been extensively studied and reported in the medical literature. I don't really have the time to take a deep dive into all the studies that show some consistent findings, so I'm only going to mention a couple. First, a study by McLean and Associates in 2003 in the Journal of General Internal Medicine demonstrated that with increasing illness severity, patients were more likely to desire prayer with their physician, ranging from 19% in a routine office visit up to 50% or more in a life-threatening scenario. A study by a friend of mine, Dr. Farr Curlin at Duke in 2007, demonstrated how frequently patients draw on prayer and other religious resources to help them deal with the spiritual challenges associated with their illness. There are so many more studies. I've just mentioned the tip of the iceberg, but the bottom line of the literature is that many patients desire prayer, that most physicians believe prayer is positive in the healthcare setting, and last, at least a third of doctors indicate that they sometimes or frequently pray with patients. So over the years in clinical care of surgical patients, I've learned 4 things, I think, about praying with patients. First, prayer demonstrates that I care for patients in a very genuine way. It's quality time that they remember. Second, the act of a surgeon taking the time to pray and bow before God is very humbling, and we surgeons, we often need to be humbled. Third, praying with patients often, not always, brings peace and relief of anxiety for many of the patients that I have prayed with. And what prayer, I think, also does for me, Brother Lawrence wrote, Practicing the Presence of God. And by taking the time to pray, it's taking some time to realize that God is with me, and that actually in practice, especially during tough times when patients are having trauma, urgent crisis, gives me peace. Last, I have found that praying with patients paves the way for future spiritual care with them. I did have an older woman that I had done surgery to remove part of her colon, and 2 or 3 days after the surgery, on the ward in a room, she started spiking a high fever, 102, 103, and I was concerned that maybe she was leaking inside or something was going on. So we did a CAT scan. It was negative. Could not find the reason for the fever. Put her on antibiotics. The fever would not go away. I asked her for permission if I could pray for her because we'd exhausted looking for the cause and could not find it. And she agreed. I prayed for her and asked God to touch her and maybe open her eyes and help us to understand the cause of the fever. Went home that night. The next morning, driving into the hospital, God just put it on my heart, and I started praying for her for about 5 or 10 minutes. Made it to the hospital, walked to the hospital, walked into her room, and she was wide awake at 5:30 in the morning, and she said, Dr. Chupp, you'll never believe what happened. I couldn't sleep all night. I had chills and the fever, And then suddenly, about an hour ago, this white light just from the corner of the room came and landed just on my abdomen, and the chills went away and the fever went away, and I felt normal. And the nurse just took my temperature. It's normal. And I said, ma'am, I was praying about that time as I was driving into the hospital. And she was so excited to match the prayers with what had happened. She Facebooked a friend in Alaska who actually used to work on that ward in the hospital. That friend in Alaska then Facebooked a nurse who was working that day on the same ward. We had a party together celebrating what God had done for this patient after surgery. When God answers prayers specifically, and I see him doing things for my patients and for me, and when I ask him for help in a very difficult operation, it builds up my trust in him. And I think all throughout Scripture we see trust in the Lord with all your heart. And so as a surgeon, we do some very challenging, difficult things that sometimes patients don't make it, but I see God walking with me. An example of God walking with me that a friend pointed out to me was when I'd been a surgeon for 15 years, and he was just observing for the day in the operating room in my hospital in Kenya and saw me washing my hands. Then when I came away, my hands were in the air. And he said, Mike, it's like you're worshiping God as a surgeon. You know, you're lifting your hands up to God as you walk into the room to do your surgery. And I had never thought about it quite that way before. And so it was transformative. He said, Romans 12, 1 and 2, you know, your reasonable act of service, your worship. And so it really transformed. Again, practicing the presence of God. God became right there beside me as I'm entering the operating room with the team. And, you know, I work with residents, share the same thing with them, that Christian residents, sometimes non-Christian residents, that this is my practice, that I pray before surgery after I've washed my hands. I'd like to share with you a simple mnemonic that I've come up with to help me and remind me to incorporate prayer into my practice of surgery and medicine, and that is using the word pray, P-R-A-Y. And the P reminds me to prepare. Before I encounter patients, whether it's the beginning of the day, before I start my rounds, maybe as I was walking up to the hospital in Africa or driving into the hospital in the U.S., praying that God will give me opportunities to bring up prayer or spiritual issues, do spiritual ministry. Often pausing at a patient's door, whether as an inpatient or in the office, pausing and just breathing a short prayer. God, help me, give me ears to hear and eyes to see, and take opportunities as they arise. You know, in the old days of paper charts and in the current time of electronic medical records, you can actually put a little digital sticky note on the computer that reminds you what you did in the encounter before, whether you prayed or not, or whether there was a concern that that particular patient had about a family issue, a challenge in their life. And I leave that as a note for my next encounter to bring up. And the patient is touched that you wrote it down or remembered. And sometimes that will actually be a springboard, a bridge to offer prayer for that issue or that challenge, to get an update. So a small hinge that may open a big door. Preparation. So P, prepare. The R and A, respectfully ask. And this is really critical. If you look at the medical literature, and what I want listeners today to understand is it's really the patients must give you permission and have the ability to say no. So when we respectfully ask, we can say something like, would you mind if I prayed for you about that? When the Spirit moves, in response to God's Spirit, would you mind if I pray for you right now about that? Or at the end, just before I leave, I say, it's my practice often to offer to pray. And you can say, no, that's okay, I won't be offended. So P, we prepare. R-A, we respectfully ask. And finally, Y, we yield to the wishes of the patient. And over the years, nearly 20 years of caring for patients in surgery, believe it or not, I've only had news. And this was a woman who I was preparing to take to the operating room with acute appendicitis. I was going to take out her appendix. And I said, you know, it's my routine to offer to pray with patients before surgery. Would you mind? And to this day, I don't know why, but she said, no, I would prefer you not praying for me, Dr. Chupp. I said, okay, that's fine. And as I walked out the door, I prayed for her. No one can stop us for praying for our patients. There is no rule, or no one's going to stop us. The next day after surgery, as I was preparing her for discharge, she did well, simple appendectomy. She said, "Dr. Chupp, I just want you to know, I really appreciate the fact that you were kind and respected my wish not to pray for me yesterday, and I hope I wasn't rude with you." So she remembered that, and sometimes that can actually serve as a stair step for a bridge, again, an opportunity for a future visit when we see the patient again. I like the quote by Pastor Tim Keller of Redeemer Presbyterian Church in New York City. In his book on prayer, he says, "Prayer is a way to experience a powerful confidence that God is handling our lives well, that our bad things will turn out for good, our good things can't be taken from us, and that the best is yet to come." And I believe as Christ followers in healthcare that it's upon us to share that confidence, that trust in God that we have with our patients as we offer respectfully and with sensitivity to pray for them, especially when we are in settings where there's acute illness, urgency, injury, and they are more apt to accept our offer. As Christ followers, I believe that we have a responsibility to facilitate spiritual care with patients, because I've discovered that prayer is a universal language of healing that goes across cultures.
I am Dr. Sharian Brown, Director of Cardio-Oncology and Assistant Professor at Medical College of Wisconsin. When I pray for patients, I often try to ensure I record it in the chart. Anything that happens in the visit ought to be documented. So I might write, "Prayer is important to this patient. Prayer was offered and received and seemed to bring her comfort." And when I write notes that are numbered, then I might put a number: biopsychosocial spiritual care, continue to offer chaplain services as needed, and continue to offer prayer as needed. And it's great to see that propagated in everyone else's notes copied from mine, which is very important for the patient's care legitimately.
I have found that praying for my patients has been one of the most important things that I do. So each day when I go into the clinic, I pull up my schedule and I pray for each patient by name. And I pray that God would bring the right patients in at the right time so that I have the opportunity and the time to minister to them the way that He would have me do it in each day. And I find that it makes all the difference.
Hi, everyone. My name is Dr. Malika Johnson. I practice in San Diego, California, and I also work for CMDA. And I wanted to speak with you today about praying. We know that many of our patients within healthcare can be anxious about treatment and that they will be receiving or different procedures. And in Philippians, Paul speaks and says to not be anxious for anything, but to pray about everything. This happened to me with one of my adult special needs patients who actually came in and asked me to pray for his treatment before we did anything. So we prayed, we bowed our heads right there in the operatory, invited Jesus in to cover that treatment. And everything went well. He has been back many times, and it definitely relieved him of his anxiety. So if you have any reservations about praying, I ask you and I implore you to go for it.
The one thing that I would like you to remember is this, that you just need to get started. And if you ask God at the beginning of a day, would you give me the space and the opportunity, an open door to pray with just one patient? I guarantee you He will answer that prayer. Thank you for joining me today for this Faith Prescriptions program on praying for and with your patients.